Hi everyone. Am I audible? Am I visible? Just let me know if I'm audible and visible in the comments. Right. I hope all of you are doing very well. So nice to see all of you here today. The screen is over here, so I'll be watching over here. Just don't mind me. Right. So nice of you. Right. Thank you. Thank you for joining in. People who will watch this later or will join in later, I have a good news and a bad news for you. The good news is that you'll be missing out on the live interaction that I'll have with my audience right now. I'll be taking questions and I'll be answering them directly here. So that's the whole fun of having a live session. And the good news for you is that you can watch it in 2x later. But this is an interactive session. I'll try to answer your questions as much as possible. But like I promised, I want to keep it precise, crisp, short as much as possible. I can't promise that depending on what kind of quirky questions you guys ask me. But I'll try to keep it as brief as possible with, try to keep it crisp. Anyways, before I begin talking about the things that I already planned to talk about, let me tell you what are the 7 pain points that I want to talk about today. The 7 pain points that I want to talk about today are: number 1, the change of the number of questions that are supposed to come in your NEET PG exam have been brought down from the 300 that were asked every year previously to 200. And the interesting thing here is that the time has not been changed. It's still 3.5 hours, which has opened up a Pandora's box for a lot of speculation and assumptions. We'll try to deal with that. The second thing is the lack of clarity in terms of the subject weightage, which subject will carry how many marks. The clarity is not defined anymore. I mean, although it was defined, but NB never followed that strictly. So I don't know how that changes. The third problem is a lot of students asking me about the preparation strategy and trying to assume what the exam paper will look like. They're asking me, will it look like the INICET exam, which had a lot of A is correct, A and B is correct, A, B and C is correct, or only D is correct. So a lot of confusion there, and we'll talk about that. The fourth problem that we're going to discuss is changing the reading pattern or the preparation pattern. Should you stick to the previous method that you've been following, or should you suddenly change and do something new or out of the box to tackle this new predicament that we are in? The fifth problem, we are going to talk about major subjects versus short subjects, para and preclinical. What should you focus on in terms of what will come in the exam and what will be more valuable for your marks? The sixth problem is a lot of students telling me that they need to start focusing on the Usmle long stem pattern type of a question. And is it a good idea to do that right about this time, 2 months before the exam? And finally, the last problem, a lot of you have been asking me, the seventh problem that we're going to discuss is, should you focus more on, concepts rather than facts? Or should you just forego of the facts and stop memorizing and just trust your instinct and understand a lot of stuff? I'm just curious how that happens in medicine. How can you not remember a lot of stuff and just only understand? Right, so we'll discuss all of that. And I'm so happy that all of you have found time to join me here today. But before I begin, I just want to give you context about how my day was like today. I had a very busy operation theater today. We had a lot of difficult cases, complex cases. I had to conduct the internal exam for my postgraduate. So that was a handful. I got my first shot of vaccine, so I'm still feverish. I started to become feverish. My child is sick. He has fever. My wife is taking care of the kids. So thank you, dear. I mean, so it's been a very busy day for me, but I had to do this because you guys just don't stop messaging. It's crazy. You've been bombarding a lot of messages on Instagram and Facebook and the Telegram group. By the way, if you have not joined the Telegram group, I've left the link in the pinned section in the comments. Join it. It's a beautiful community there. Most of the questions that we have discussed have already been hammered out to its core in the group, and a lot of people are there who will help you sort out your problems, and they have these beautiful strategies that they're discussing and whatnot. So it's an amazing community. The Study Revolution community has taken shape in the Telegram group, and we have more than 17,000 people there who are willing to help each other out. And I love that. It's beautiful. So let's just start. So hi everyone. So let's just start. So let's start with the first pain point. The first pain point is 200 questions in the same 3.5 hours. Sir, what's this mystery? Why did they do this? So again, I'm not from the board, so I don't have any factual information here to give out to you, but I'm just the voice of reason that you guys are probably missing. So let me just tell you what I feel, and maybe you can take it up with a pinch of salt, and trust me or not, it's your choice, but this is what I feel. Listen to me. See, the last year exam was a lot of clinical questions, right? And a lot of the students that I've talked to after the exam have told me that they couldn't find time to go through the whole paper. That was the biggest challenge that they faced. Time nahi hai sir humko. We couldn't read all the questions, and it just felt like one patient after another, and it was like 300 OPD patients, all of them coming with the different problems, and we had to start thinking about them and answer the question in a few minutes. So that was a huge challenge. The challenge was you needed time to answer those questions. So my guess over here is the fact that the board understood that was a challenge, and you couldn't think around the correct answers in that limited time. So assuming that they are benevolent, they have reduced the number of questions to give you that time needed to go through them extensively and then mark the correct response. So I feel it is going to be exactly like those 300 questions that showed up last year. But now you will have ample time and no excuses for not being able to answer the questions in the exam, or at least finish reading the whole paper. So that is something that I want you to understand is a real issue here. Last year we did not have time. Now we will have time, and it doesn't mean that you will have a lot of time. You still the clock is running and the time is less, but it is decent enough to finish reading all the 200 questions. And that is what I strongly feel. I strongly feel that is what is going to happen. There is not going to be a huge change in the type of the question and the pattern. It's going to be the same clinical paper with multiple lines of question, but you will have enough time. So you can't complain saying ki 300 patients the OPD ke 3.5 hours mein, now you have 200 patients to see. And that is one of my strong assumptions for this exam. And the second thing is, a lot of students, they find difficulty understanding what the question is asking. So there is a interpretation problem. This is what I feel. A lot of students, they have interpretation problem. They don't interpret the question properly. They don't understand what the examiner is asking of them. So that challenge can be sorted if you have time to read the question and understand what the question is telling you. Now long stem questions, or the clinical questions that you are imagining in your head that you see in Usmle, and we'll talk about more about it later, are very long questions. They are paragraphs of questions. And the reason I don't think that they will show up in your NEET PG exam is because I strongly believe that you don't have enough time to go through all of them. Usmle is a 6, 7, 8 hour exam. They have lots of blocks to cover, and ample time is allotted to answer those questions. But this is not that kind of an exam. And I don't think the board has the patience or the time or the resources right now to, design those kind of questions, unless they just copy and paste it from some Usmle material, which I don't think they will do. So those kind of long paragraph based questions, I don't think they will be there. If at all, a few, 1 or 2 might just pop in there to just, keep the boat afloat. Otherwise, I don't think that is a real or a strong possibility. That's not going to happen. Usmle wale questions, I don't think they have a place in our exam. Right. Now, the reason I feel they have given you more time is, number one, you guys complained a lot. There was a lot of backlash previously last year because time nahi tha, paper bada tha. Now you have time. So, there will be a lot of back and forth from the question and the options, because once you read the question, which will be, a few lines of question, and then you go to the options, and then you suddenly recollect ki kuch point upar tha. So you go back to read the question, and then you come back to the options. So there will be a lot of back and forth from the question to options and options to questions. I think this, this skewed ratio of time and questions will help you tackle that problem. You have more time to do that. You have more time to run around the question figuring out whether this option is correct or not. And as we go through the session discussing all the 6 problems, I'll tell you more about why I think that is more of something that is going to happen in the exam rather than just Usmle style questions. So did you understand why I feel that these 200 questions are not a game changer? In fact, they are just an evolution of what happened last year. They'll give you more time to analyze those OPD patients that you were talking about. Is that clear? I think I strongly believe that is the case, right? I strongly believe that is the case. The next thing I want to talk about is the lack of clarity in terms of subject weightage, right? So this was the second pain point that all of you were asking me in the Telegram group and Instagram group, the lack of clarity in terms of the weightage of subjects. Now, let me just tell you what I figured out. I think NB is just lazy here. Number one, I mean, this is a joke. Don't take it too hard. I think they might be just too lazy to give you exact quota of questions coming from subjects, because they never actually stuck to that. Although every year after year, they would give you a quota of marks for a particular subject, they would not strongly adhere to that. There was a lot of overlap in questions would range around that figure. Suppose they said ki forensic medicine may say you will get 10 or 15 questions, they would range from 8 to sometimes 12 to sometimes even 18. So there was a lot of play. There was nothing exact about this figure that they would give you. And obviously every year there was some backlash, because they would say ki this is the number of questions that they're going to give you, but then they never did. So they tried to avoid that this time. So I'm guessing they avoided this by not telling you the exact number of questions that will come from each subject. But again, that was just me being funny and me being lazy. That's not something to worry about. What is important here is, I feel, instead of giving you the quota of questions from a particular subject, which is not honestly very possible if you're planning a question paper that is designed to basically evaluate your understanding of a patient scenario rather than MCQ scenario. Because I believe if NB is delivering what they promised, an exam that will assess students better compared to just people who memorize stuff, they want you to start thinking of each question as a patient rather than an MCQ, right? So that is what I feel. So instead of focusing about thinking how many marks will come from a particular subject, they want you to start thinking of what are the problems I see in this patient. So each question is basically a patient, and they want you to think in terms of a patient rather than in terms of a defined subject wala MCQ. It can be an obs-gyn patient, it can be an OB-gyn patient who presents to you with a medical problem. It can be a general surgery patient who also has an associated ENT problem, or it can be an ophthalmology patient who has a dermatology condition or a skin condition. They want you to start thinking about a patient rather than an MCQ. And this will give you an advantage not only in your exam but also in life, because patients, they don't present like MCQs. The patients present with their problems, and then when you talk to a patient and you listen to them in the OPD, trust me, you will have to cut out a lot of fluff in their lives. They will tell you a lot of random stories about their problems and their family issues, and if you patiently listen to them, they keep on telling you the same story again and again. So what you have to do is you have to cut down, ask those specific questions that you're looking for in order to help them. And I think that is what you should also focus on. I'll talk up more about this later. I think that is what you should be focusing on in terms of when you read these clinical questions. You should look for those keywords, those words that will define what your answers are. I'll talk more about this later. And obviously, by not giving you the clear-cut weightage of the subject, they are basically telling you that we are going to focus more on the clinical presentations of the patient rather than specific question and answer. So this obviously implies that a lot of questions will come from the clinical subjects, right? The final and the pre-final year subjects. The pre and paraclinical subjects will obviously take a backseat in terms of direct questions, but they will also be part of the question vignette, and I'll explain how that will happen. Okay, so if I was not clear, let me just quickly tell you what I feel. The emphasis will be more on a patient rather than an MCQ, and that is why it is very difficult to allot weightage to the subject because patients हैं, subjects नहीं हैं. So you have to think in terms of the patient, and that is what they're trying to inculcate in you by giving you this paper and not giving you the weightage of the subject. ठीक है, समझ आ गया? So that is why you don't have weightage, and obviously when you don't have weightage implies that the questions will be more clinical, which obviously implies that you should be focusing more on the clinical subjects, the final year and the pre-final year. All right, so you should start focusing on that. That obviously does not mean pre and paraclinical are neglected. I'll tell you how they are also extremely valuable for your exam. Right. Coming to the third pain point, sir, questions INICET wale rahenge kya? Will the questions be like the INICET pattern type questions, where you will have a lot of A is correct, or only B is correct, or A, B and C is correct, or A, B and D is correct? Right. There is a possibility that yes, they can show up. But I don't strongly feel that it will be there, because there has to be a distinction between an INICET exam that is supposed to be an exam for the institutes of national importance and the exam that is for the mere mortals, the NEET PG exam. There has to be a gross distinction, right? There has to be a gross distinction. So by the way, please, there is enormous amount of messages, comments coming. I'm not reading them right now because I want to finish the pain points first, and then I will go about talking, looking at the questions. So if you say something funny, I'd probably miss it. Right. Anyways, so what I'm trying to tell you is, yes, INICET ka distinction rahega, because it has to be, it's a different exam, and NEET PG ka bhi distinction hona chahiye. It has to be there. Otherwise, what's the point, right? So those kind of questions where you will have A is correct and only A is correct, or A, B and C is correct, they might show up, but I don't think pura paper waisa rahega. I don't think it will happen like that. One or few or more questions of that kind will be there. And to give you a reality check, before the actual INICET exam, did you guys prepare differently for it? No, right? You were preparing exactly like how you assumed it would be, a single best answer wala exam. And a lot of you did well. So I personally feel that this tells you कि preparation change करने से कुछ नहीं होता है. It's the knowledge that you have that matters at the end. ठीक है? Are you following what I'm trying to tell you? Right? None of you changed your exam preparation pattern just before INICET, right? But you went to it, and then you saw that paper, you dealt with it, and you came out. A lot of people got good ranks. So ऐसा नहीं है कि आपका preparation overnight change होने से आपका exam में result change हो जाएगा. Whatever you have worked hard so far for will actually matter, and I'll tell you how in the end again. Right? So INICET pattern वाले questions, yes, possibility है आएंगे, but not all of them will be like that, because there has to be a clear distinction between INICET exam and NEET PG exam. ठीक है? Right. Now the fourth pain point is, should I change the reading pattern based on this change of questions, or should I stick to my previous methods? This is a very interesting question. My question to you is, before I answer this question, my question to all of you is, what do you think you will do now that will give you an advantage or an edge if the questions have been reduced? What will you do? What are you planning to do? What do you think? Right? So you will say, I will start preparing Usmle wala questions. I will do that. I'll focus more on the final year subjects, and I will do, but honestly, none of you know what is the real outcome of all the efforts that you're going to put in, right? Just based on this decrease in the number of questions. So I don't think there is a scientific approach to this. So if there is nothing scientific, let's not discuss that. But this is what I will tell you. Because it's going to be a clinical paper, and because it is going to be more patient-oriented question rather than fact-oriented question, I want you to focus on patient management. Right? So how do you do this? I want you to focus on indications. Whenever there is a surgery or an investigation, focus on the indications of it. Why would you want that investigation to be done? Right? If this scenario changes, how will the investigation of choice change? If this scenario changes, how will the treatment of choice change? If the sex of the patient changes, how will the drug of choice changes? If the patient were pregnant, what would be the alternate medication that I would give to her in case of this disease? Right? So I want you to start thinking like this rather than just thinking or just memorizing the drug of choice. So suppose there is a condition where you give a certain medication. I don't want to be too specific because I don't want to confuse you, but suppose there is a condition and you give the drug of choice for that condition is XYZ. Now, if that condition is seen in pregnant women, you would want to give another drug, right? Because probably that drug is contraindicated in pregnancy. I want you to start thinking like this, because the clinical vignette or the clinical question that may show up in your exam may start out with a scenario that presents with a typical condition, but at the end, the examiner might tell you, and since this patient is pregnant, what is the drug that you would advise her to use, right? So focus on indications, what will you use when, and why will you avoid it if you will avoid it. So that will give you the idea of how to approach the patient. Second thing, what are the various modalities of management and what are their indications? If a particular fracture, for example, can be managed by a plaster of Paris, or can be managed by closed reduction internal fixation with K-wires, or can be managed by open reduction internal fixation with plates, I want you to understand in which scenario will you use which management, right? So which modality of management will you prefer depending on the presentation of the patient, because that is what they will ask you. If you remember in my classes and my videos, I tell you this: if a patient comes to you with a shaft of humerus fracture and a wrist drop, assuming there is a radial nerve injury, you will manage it conservatively because these radial nerve injuries are neuropraxia. But if a patient comes with an associated open fracture with an open wound, you would not manage it conservatively because the wound is already open. You would prefer to explore and release the radial nerve it is injured, and then you treat the fracture. So this patient management scenarios will change depending on the presentation of the patient to you, and that is how these questions will be framed. The questions will look benign, and they will be benign. There is nothing scary about them. The scenarios will also be benign, but there will be specific scenarios, and the reason they are testing you this way is because this gives you the understanding of the subject rather than just memorizing. ये investigation इसमें करना, ये investigation इसमें करना. Nobody wants that. Nobody wants machines. People want doctors who can think. People want doctors who can analyze and then give you the right answer or the best answer in that particular scenario. So focus more on understanding the indications, why you will get that investigation, various managements, why yes and why no. If you understand that, if you go approach the subject like that, I think your approach to the exam will be, you'll be exam ready, right? You will be exam ready, and that is what the exam will eventually end up doing, right? Maybe this exam will be halfway there, but next to pakka wahi jayega. That is the end goal of all these change and evolution in the pattern. They want credible people qualifying, getting good ranks, who can think, who can analyze, and then who can give solutions that is scientifically relevant, rather than just fracture hai to plate karo, fracture hai to nail karo. They don't want machines, they don't want bots. They want doctors who can think critically, analyze the solution, and give you a case scenario based answer, right? That is what they want at the end of the day. So that is how they will ask the questions. Okay. Now, the fifth pain point that I want to discuss, I'm a little breathless, just hold on. All right. The fifth pain point. Yes. Happy Days is saying even Abbasir is afraid of saying the drug of choice because even they are debatable. Absolutely. And that is what they want you to know, right? They want you to know why yes and why no. That's all, right? And that is how you should approach reading all the scenarios. Anyway, the fifth pain point that we're going to talk about is, should I focus only on the major clinical subjects and skip the short subjects? Right. So the answer is an absolutely no. No, absolutely not. Do not skip any clinical subject. Whenever there is a scope of a patient presenting to you with a problem, that subject should not be ignored, which means any clinical subject should not be missed. Extremely valuable for your exam. I think by now you must have understood, right? The 20 minutes of discussion that we have had so far. No clinical subject should be spared. The patient can present to you with a dermatological problem, starts the question with a dermatological problem. At the end, they will say the patient is pregnant, and at the end, they will ask you a question from pharmacology. So all of this will happen, and all of this can happen and should happen to assess your knowledge, right? So do not leave clinical subjects, right? So if you're thinking about leaving pre and paraclinical subjects, that is also not correct. That you should not do that. And that is the seventh pain point. I will discuss about that in the seventh point. But here in the fifth point, absolutely not. Short subjects, yes. Major subjects, yes. Clinical subjects, so you should know. But as far as the short subjects are concerned, like say skin anesthesia, radiology, psychiatry, dermatology, and all these subjects, orthopedics, they are highly fetching because, see, even though they are clinical subjects, the examiner isn't expecting you to know all of it, right? Medicine and surgery and obs and gyn, they expect you to know quite a lot of it because that's what you do in final year of MBBS. You've started your medicine, surgery and gynec posting in second year of MBBS. So they expect a lot in those subjects, but the short subjects, they don't expect a lot. So what they focus on is the key areas and the key topics and the fundamental things that you should know about. For example, if you're going to this exam without knowing the supracondylar humerus fracture in orthopedics, You guys are making a huge blunder. You should not. Supracondylar humerus fracture is extremely important in orthopedics. Monteacher fracture, Colles fracture is extremely important. Similarly, if you're going for the exam in dermatology, you should know, the conditions. I don't know what you should know, but you should know those key pathologies that is heavily tested. So herpes hai, and I don't know dermatology, but what I'm trying to tell you is those things are very important. And the beauty is that in short subjects you don't have to go into a lot of areas. Focused areas pe focus kar lo, you will be able to answer most of the clinical questions without a lot of hassle, right? Without a lot of hassle. I think that has taken care of the fifth pain point. Now the sixth pain point is, sir, should we immediately shift to USMLE wala questions for long stem questions, because that is what is eventually going to show up. And I think I touched upon this in the beginning. I told you that it is unlikely that you will get those long paragraph wala questions that you get in USMLE, because it's a long exam, an extremely long exam. It's it's an articulated exam. It's a well designed product, and it's been done since many years. And this is the first time NB has taken the responsibility of changing the pattern and doing this. So I don't think that it is going to happen, because this is still at the end of the day a 3.5 hour exam. So those paragraph wale questions honge, maybe 1 or 2 or 3 may be there, but not a lot of them. Most of the questions will be the questions that will start looking like one subject and then move into the second subject and then ask you a very basic pre and paraclinical wala question. So I don't think you need to worry a lot about going to USMLE. But yesterday in my Telegram group, there was a very interesting question asked by a student. He said, sir, I have prepared for USMLE step 1. Should I go back and revise those books that I have prepared for USMLE 1? Will that be beneficial? See, I'll tell you this. Anything that you have done in your life, you can leverage it right now. Anything that you have done, anything, whether you have attended clinics, whether you have, a senior who has guided you, or a father who has guided you, or a friend who has guided you, anything that you have done, you can leverage for this exam, or anything in your life, right? So past achievements can be leveraged for future success. So if you have achieved success in USMLE step 1, that knowledge you should definitely leverage. You should not skip it. You should definitely leverage, go back to those books, review whatever you have read, and then go for NEET PG exam. You will definitely have an edge compared to people who don't have that advantage. People who have other advantage will definitely have that kind of advantage, but you have this advantage, so use it. So people who have prepared for USMLE step 1, who have cleared your step 1, and if they have notes handy, I think that is a good idea. You should always leverage. You should always leverage your past success. That will definitely help you in your future goals and successes. Okay? So if you have some great notes that you have written in MBBS professional exams, go back, revise it. Doesn't matter, right? So past success ki advantage ko definitely leverage karna hai. And the last pain point, last pain point. I'll take questions after this, so stay tuned. The last pain point, which is actually very interesting, is that should we just stop memorizing facts? Should we just not memorize the facts and just understand concepts and read concepts? For example, one fellow was asking me, sir, should I stop remembering the names of the enzymes that are deficient in certain conditions, the list of enzymes in various glycolipid disorders and whatnot? See, you cannot stop memorizing facts, right? Facts will always be facts. Let me give you a simple example, right? Listen. What is your name, right? Your name is a name, which is a fact, and there is no understanding your name. There is no story behind your name, right? The story is Papa ne diya, Mummy ne diya, ya Dada ya Dadi ya Nana Nani ne diya. But it's a fact. I have to remember your name in order to, know who you are. So facts are designed to be memorized, and there is no understanding facts. For example, what is the normal serum calcium level? 9 to 11 milligrams per deciliter, right? So that is a fact. You have to memorize a fact. My telephone number, it's a fact. You have to memorize it. There is no understanding the telephone number. Now you can find stories and you can find methods to memorize the facts, but at the end of the day, a fact is a fact. You have to memorize it. And the reason I'm telling you have to memorize it is that it will never leave your side. It will always be there forever, right? For example, in Monteacher fracture, where there is a fracture of the ulna and the radial head dislocates, the posterior interosseous nerve, which is a branch of the radial nerve, by the way, gets injured. And we understand that how, because when the radial head dislocates, it impinges or compresses or hits the posterior interosseous nerve and it can get injured, right? We understand that. But as you go through all the fractures, in orthopedics, you'll understand that shoulder dislocation में तो axillary nerve जाती है, clavicle fracture में possibly brachial plexus injure हो सकता है, shaft of radius humerus fracture में radial nerve injure होती है, so posterior dislocation of hip में sciatic nerve injure होती है. So what do? At the end of the day, you summarize all of those facts, right? And you place them in a table to memorize and review them. You have understood it. You have understood why it happens. But you, at the end of the day, you have to review that piece of information quite rapidly and you have to memorize those facts. Another example is the various, glycolipid disorders, right? So Fabry's disease, Gaucher's disease, that disease, this disease, which enzyme is deficient in that disease. You've understood why this disease manifests. You've understood that this enzyme deficiency will lead to, a certain byproduct of that cycle or process accumulating in the body and giving you the manifestations clinically, or the deficiency of that enzyme leads to the deficiency of the end product of that cycle and giving you another clinical deficiency or problem. You've understood that, but at the end of the day, you have to memorize that enzyme, right? Because that is how the exam will frame the questions. They will ask you a question. They will tell you all the clinical features that match Gaucher's disease or Fabry's disease or whatever disease, unborn Gerke's disease, and you will know that the examiner is talking about that disease, and they will just simply ask you, what is the enzyme most likely deficient in this patient? So now comes the point where you should have that answer ready in your mind, and that only happens if you memorize that, right? So memorization will always have a role and a place in medicine, or in fact anything in life, right? You cannot skip facts. You have to memorize facts, but how you do it and how it is useful, that is more important now. When you're memorizing a piece of information, always ask, why am I memorizing this? How is this going to be asked? If there is a table of information and you're just blindly memorizing it, don't do that. Ask yourself, why am I memorizing this? How will this be tested? How can I use this fact to answer a question? If you start thinking like that, you yourself will understand that these are the facts that will not be asked in the exam, and you can just confidently ignore it and move on with your life. But again, you'll come across a table that is heavily tested, and so you will focus time and memorize that. So there is no escape from memorizing facts. You can't escape it. It will always be there. It's just ask why you're remembering it. Why is it important to remember? And then I think in that part of your problem will become easy. Okay? Right, guys? So these are the 7 pain points that all of you have asked me, and I apologize, I couldn't come live previously or a few days back when the notice came out, because I didn't feel the need to, but then you guys have hammered me so much on Instagram and Telegram that I thought I should do this, and I've done this. I have answered all your 7 pain points that were there. But if there is anything that I missed, let me just look at the comments and I'll try to answer. Non-clinical पर थोड़ा कम focus करे तो चलेगा sir. Basically he's asking, should I not focus on para and preclinical, anat, physio, biochem, patho, pharma, micro subjects? That's what he's telling you. The thing is that you cannot build the clinical subject without pre and para clinical knowledge. and I don't understand how you can say that yourself. All of you are doctors. You understand the importance of understanding the complex clinical scenarios based on the knowledge that you have from pre and paraclinical subjects. You cannot understand the pathogenesis of a disease without understanding the pathology. You cannot understand the clinical features of a particular condition without understanding how that disease affects either your physiology or the microbiology of your body. You have to understand that. You have to know that an organism enters your body, releases a certain kind of toxin, and that certain kind of toxin will give you that kind of clinical presentation or manifestation. So in order to understand that, you should know which organisms release those toxins, which again brings back to the importance of pre and paraclinical subjects. So I don't think there is escape here, right? Let me be blunt and honest with you. If you're thinking that just by focusing on the clinical subject, you can just cut the syllabus into half and then your life will become easy. I have bad news. That is not going to happen. Each and everything that you have learned in your MBBS curriculum, starting from anatomy all the way to radiology, are extremely valuable in terms of helping you coming to a solution for the patient, right? And you cannot ignore that. But at the same time, what I mean to say is that, yes, direct questions like the pterygopalatine nerve is a branch of XYZ nerve. Those kind of questions will obviously have no place here. But definitely they will ask you, if a patient sitting on the chair with the backrest, arm resting on the backrest, and he sleeps overnight, he wakes up the next day, is unable to extend the wrist, which nerve is likely, affected? That is when you talk about your Saturday night palsy, and should know that the radial nerve traverses over the humerus. So your understanding of anatomy will be assessed in a clinical scenario, which means that direct questions from anatomy where they show you an arrow and ask you what this nerve is might not, see the light of day in this exam. But that knowledge is important, which means you cannot escape it, right? So don't be smart. In fact, don't be over smart and think, wo question aayenge nahi to padhenge nahi. Again, when you're reading the anatomy of a particular nerve, when you're reading the anatomy of a particular artery, understand what is the clinical significance of its anatomy. What is the clinical significance of the nerve or the vessel taking that particular track? All right. What are the complications that will happen if there is an injury over here? Which muscle will be paralyzed and which muscle will be spared? So anatomy will be tested, physiology will be tested, pathology, microbiology, pharmacology will be tested, but all of them in clinical scenario, which will actually be easy for you. Because trust me, when the questions are not direct, like this is a branch of which nerve, that is a branch, I think those are difficult to answer because it relies too much on memorization. When you put it in the shell of clinical scenario, they become more palatable and more easy and clinically relevant. They will not only help you clear this exam, they will also make you a better doctor tomorrow. So I think I have answered your question quite earnestly over here, right? All right. Anything else you guys want to talk about? How many questions to attempt, right? As many as possible, always aggressive. That's been my strategy. The ratio of positive to negative is +4 to -1. So it really doesn't matter, but don't worry. I'll definitely come again and tell you the exact thing that you can do for the exam. Right. I think I've basically answered all the questions here. So let me just summarize everything and close this session. And by the way, I love all of you. You can sit down here today and keep blaming the NBE for doing this to you. You can cry a river, you can sulk, you can be miserable, you can be angry, and you can curse, and you can do whatever you want to. Or you can own this change and fight for it. Right? Own it, fight for it. Because, see, NBE could have done this just a few days before the exam. They could have just informed you a few days before the exam, and no one, trust me, no one could have done anything about it. But the bright side here, the silver lining here is that they've informed you about it, a good 50 days in advance. So you have ample time, and ample time to adapt and change. Yes, I've told you, focus more on the indications and whys, right? But also ample time to, adapt your mind to this change that you will see in the exam. Because most of the people who went to INICET were suddenly bombarded with this new type of a question paper, and they were, it was a shock. It was a rude shock. It took them a good 15-20 minutes, half an hour even to, realize कि पूरा exam ऐसा है और हमको करना है, and we did it. But now you are mentally prepared for this, and when you actually go and see this paper in the exam hall, you will not be, welcomed by a rude shock. You will be expecting this, so you will be much more able to deal with it in a sensible manner. So I think it is good that they have informed you. So that is the bright side I always look for, because there is honestly no point crying a river and bickering. I mean, it's fun. I have put out a few memes on my Instagram handle, blaming the NBE for doing all these things, and we've made fun of their real-time photograph, and it was so much fun. But at the end of the day, I think it is a good move. It's an evolution in our exam process. Our exam process was becoming redundant every year. Now they are focused more on bringing out, people who can actually solve problems rather than people who can just memorize information. So we want doctors who can solve problems rather than people who can just memorize facts. The exam will be fun. I have a strong belief that the exam will be fun. It will be more engaging. As you read the question, there will be this clinical scenario that will start developing in your mind. You'll start thinking of a patient, and then you'll step by step understand what the problem of this patient is, and then you will come to a reasonable conclusion, and then you will be able to answer. It will be tedious. You'll be, going back and forth between the question and options a few times, but you will enjoy it. And this exam, if it lives up to the hype that it has created, being more clinical, I don't know. I really don't know what is clinical essentially. And I think that's a big video. We can talk about that later. But at the end of the day, if the exam lives up to the hype that it's building, I feel it will truly reward the people who are deserving. So all of you who have been working so hard, who have been preparing so hard for so long, I think this is your time. This is your time. You always had this fear na कि last minute में जो बच्चे पढ़ते हैं and they suddenly overtake you in their life, in your life, and they get the better ranks because last minute में पढ़ाई कर ली और हो गया, उनका set हो गया, and you've been working so hard for so many years. I think if this exam lives up to the hype that it is building, I think this will be the rewarding exam that all of you have been waiting for. This will be the exam that will bring out champions from people who have been starting early, and I think it's the best thing that can happen to you. So enough of memorizing random stuff, more of understanding and applying. It will be fun. It will be engaging. Don't change whatever you're doing. Just keep doing that, but with a slight modification of understanding why. So if there is anything that you have been memorizing without the why, stop, ask yourself why you are memorizing this and how they can ask you this, and then you will be able to answer. And I think keep practicing the questions. That is the most important thing here, because even if you keep on reading information, it's not going to help you a lot. But if you practice the questions, it will constantly remind you of the whys, because the question asks you why. The question asks you why not. So if you practice more questions, I think you will have an advantage. So my parting advice to all of you is practice more questions, friends. Practice more questions. If you're doing 50, do 100. If you're doing 100, do 200. If you're doing 200, do 300. And I think you'll be fine, right? So it was so nice talking to all of you, and I wish you guys all the best. If you have any follow-up questions or queries or problems, join the Telegram group. The community is awesome. They will definitely help you. You can also follow me on Instagram, and I definitely respond to you on Instagram. I have a Twitter as well now. It's fun there. But at the end of the day, just keep doing what you're doing. Practice more MCQs, and I will definitely see you happy on the other side. Good night.